Thank you so much. My name is Deborah Billings, and I have spent the last 30 years working diligently as a public health professional, focused on health and human rights around the world, including here in South Carolina. I'm also a person standing in front of you here today. I've been testifying on this issue for the last 12 years here in South Carolina. So I don't have the fantasy that I'm going to change anyone's mind here, but I want to be on the record to say what I'm going to say. And that is that your support for severe penalties on abortion and abortion-related issues on women, on healthcare providers, and rumor has it, on anyone accompanying women, are not going to go well. This kind of legislation interferes with privacy and freedom. It also results in severe health outcomes. How do I know this? Because I've worked in African countries, in Latin American countries, in Asian countries with their ministries of health, in hospitals, especially countries where abortion is legally restricted. The only thing that happens with those legal restrictions, because don't fool yourselves, when people need or want to have an abortion, they will do what's needed to get that abortion. When there are legal restrictions in place, it's more likely that that procedure is going to be unsafe. So what you need to be prepared for in terms of responding to us as residents of South Carolina, you need to prepare health systems for an influx of women with complications from abortion, unsafe abortions. You need to put more resources into healthcare, and you need to be prepared for an increased rate of maternal mortality and morbidity in a state that is already disproportionately high. I don't think that you're going to do that. What I would expect with the kinds of legislation that is already in place and that's being proposed is that you would put your energies now into ensuring that state dollars are dedicated to prenatal care for all people, including undocumented residents here, which is not a possibility right now, to paid parental leave for all working parents, not just state employees, to food security for families, to public education, to affordable housing and utilities. But when I look at the voting records of many of you, and I look at the state of this state, that is doubtful. So I just want to close to say, with this kind of legislation and your voting records, your pro-life rhetoric is empty. We deserve better, we have a right to better, and your proposal on a total ban of abortion does nothing to make people's lives better here in the state of South Carolina.